drug and alcohol addiction and the effects on family, children, and society. Drug, alcohol addiction, and overdose are a huge problem which is affecting our society, families, and children. One of the major issues our society is facing is teenagers becoming addicted to drugs and alcohol. Many teenagers are not only using drugs and alcohol, but start selling drugs to maintain their addiction and get arrested. As a result, this is not only affecting teenagers struggling with addiction, but also facing incarceration as adults. More so, many teenagers dealing with addiction become suicidal. For instance, teenagers using alcohol and marijuana are more likely to become depressed. Teenagers between the ages of 16 to 19 using alcohol are at a greater risk of suicide. Some of these young adolescents have co occurring disorders that cause more havoc in their lives. For example, the huge issue of drug and alcohol use and abuse during adolescence leads to overdose, addiction, and criminal behavior. We need to look at what is the root cause of addiction, overdose, suicide, and incarceration. After all, this is a huge public concern for our communities and families. Why are young adolescents using and abusing drugs, alcohol, and becoming a part of the incarceration system? Young adolescent criminal behavior can be driven by many factors. For example, poverty can be a driven motive for criminal behavior. Therefore, a young teenager can get caught up in using and selling drugs as a way to gain fast money. As a result, this adolescent ends up in the prison system. This behavior increases the risk of abusing drugs, alcohol, overdose, and suicidal tendencies. This can include numerous prison incarcerations for teenagers of active criminal behaviors. For example, during adolescence, many teenagers are also at risk for dangerous gang related influences. Drug issues in prison. Research suggests adolescents that are at high risk include no parent at home and children living in poverty. A lack of parental guidance and poverty not only affects school performance, but is a high risk for criminal activity. The concern with youth incarceration in some adolescents becoming hardcore criminals in the system long term. Believe it or not, the bigger issue is the accessibility to drugs and alcohol inside the prisons. As a result, this issue keeps teenagers in a cycle of repetition for drug and alcohol abuse. More so, causing a potential overdose and a high risk of suicide. For example, the issue of teenagers includes alcohol and opioid use behind bars. This is a critical issue because teenagers are at high risk for fatal overdose. Drugs and death. Overdose deaths are increasingly high because of a combination use of opioids, stimulants, and mental health prescriptions. In other words, many adolescents are struggling with mental illness. Young adolescents combine their prescription medication with alcohol, opioids, or stimulants, and this becomes a deadly cocktail. Regardless, adolescents' brains are not fully developed, and this all affects the brain and poisons the body. For example, a stimulant can attack the central nervous system and poison the body, causing death. Many teenagers have mental health issues along with addiction disorders. For example, a teenager suffering from bipolar disorder and has an addiction to opioids. Co-occurring disorders are a huge issue that can lead to overdose and or death. Different aspects of addiction, causes, effects, and treatments. Causes and effects. Addiction is typically linked to many causes of patterns from addictive behaviors. Let's focus on particularly addictive behaviors related to trauma. Early trauma leads to addictive behavioral patterns and compulsive behavior. In other words, in many comorbidity clinical cases, drug and alcohol addiction, overdose, and suicide is closely related to trauma. For example, many addictive behaviors are linked to the traumatic event the person was faced with. As a result, the trauma can impact and affect how a person behaves compulsively and addictively. A person with trauma is likely to start drinking alcohol and smoking marijuana, leading up to other substances. Unfortunately, the issue of smoking marijuana is that it's known to be the gateway drug leading to other drug use and abuse. Cause and effects. An individual with trauma would be more likely to use alcohol or drugs to relieve pain. For example, a young war veteran that has endured trauma and tragedy, suffering from post-traumatic stress, is often medicated by alcohol and drugs. However, an individual can make an intent for abstinence and struggle to do so. For example, the individual may struggle due to addictive suffering behavioral patterns. This can create a pattern of self-medication, making it difficult for the individual to stop the addiction. Even though the individual may seek out treatment and will find it difficult to commit to changing their behaviors. However, there are effective treatments that can help an individual create a life of sobriety before death occurs, if they're fortunate to survive addiction. When addiction spirals, it can be instantly deadly with no chance of recovery. Treatment. There are many treatment approaches to preventing and treating addictive behaviors. Researchers and clinicians have found that pre-existing addictive behaviors can be challenging. For example, many clinical cases demonstrate key concepts of recovery are challenging. Alcohol and drug abuse are serious social problems with major impacts on public health requiring treatment. According to American Psychiatric Publishing 2015, behavioral addiction diagnosis and treatment of patients display specific characteristics of substance use disorders. For example, some of these characteristics include troublesome behavior, tolerance, withdrawal, irritability, obsessive thinking, or engaging in addictive behavior. Also, some external consequences related to health, finances, interpersonal relationships, and legal affairs. Addictive behavioral patterns affect the individual's brain and cause even more suffering. The disease model of addiction requires an increased intention and pharmacological treatment and psychotherapy modalities. For instance, the disease model claims that physiology and genes are malfunctioning and believe that addiction is fixed through these methods, suggesting that genetic attributions for mental health are linked to biological forms of intervention and can effectively work to treat these behaviors. Furthermore, another method available is cognitive behavioral therapy and the person's ability to focus on a growth mindset. A person needs to develop a growth mindset to change the behavior. The individual needs to believe they can change their addiction to alcohol and or drugs. For example, the person can change their mindset by setting an intention of claiming, I can maintain sober from alcohol and or drugs. This mindset will help the individual get through treatment and remain sober, even when it seems impossible. Conclusion: drugs, alcohol addiction, and overdose are a huge problem which is affecting our society, families, and children. One of the major issues our society is facing is teenagers becoming addicted to drugs and alcohol. Many teenagers are not only using drugs and alcohol, but start selling drugs to maintain their addiction and get arrested. This is affecting our teenagers that are struggling with addiction and facing incarceration. This issue can lead to criminal behavior and imprisonment as an adult. Overdose deaths are increasingly high because of a combination of use of opioids, stimulants, and mental health prescriptions. Many adolescents are struggling with mental illness and dealing with trauma. This addictive behavioral patterns and compulsive behavior can lead to drug and alcohol addiction, overdose, and suicide is closely related to trauma. The addictive behaviors affect the individual's brain and causes more suffering. The disease of addiction requires pharmacological treatment and psychotherapy. Through proper treatment, a person can recover and live longer.